Welcome to the deep dive. We're here to plunge into some complex topics, really aiming to pull out those vital nuggets of knowledge you need. We want you to be well informed, maybe even surprise you with a few facts along the way. Today, our mission, our focus is cutting through the noise to give you a powerful shortcut, really, to understanding two critical conditions in cattle. Often life-threatening ones, bloat and choke. We're talking about insights that, well, they could quite literally save an animal's life or prevent some immense suffering.
And that's absolutely right. Understand these conditions. It isn't just about textbook veterinary stuff. It's more about appreciating that incredibly delicate balance of animal physiology and seeing just how immediate and frankly devastating the impact of environment and diet can be. The rapid progression of both bloat and choke, it really just underscores the profound importance of quick recognition and, of course, immediate action.
Okay, so let's unpack this first one. Our first deep dive takes us into cattle bloat, technically known as ruminal tympany. So at its core, bloat is basically an excessive buildup of gas in the rumen. That's the animal's biggest stomach compartment. Gas that the animal, well, it just can't get rid of through normal belching, which has a technical term, eructation. It's actually a surprisingly common cause of sudden death in cattle. You see it particularly in feedlots or out on pasture.
Yeah, and what's really critical here, the mechanism, is that the cardia region. And that's like the doorway from the esophagus into the rumen. It gets blocked. That blockage is precisely what stops that essential gas from being released.
Right. And this leads us then to two main types of bloat. Each one has its own pretty fascinating, sometimes surprising way it works. First up, there's frothy bloat. What's truly remarkable, maybe even a bit weird about this type, is it's caused by this stable, persistent foam. It literally traps the gas. We're not just talking bubbles here. It's like a dense foam, almost like setting concrete sometimes. It's commonly linked to grazing certain plants, highly digestible ones, especially those lush legumes, think alfalfa or clover, particularly when they're young, immature, in that pre-bloom stage.
And it's the soluble leaf proteins and those tiny plant particles in these forages. Those are the key things that create this really stubborn foam. And interestingly, you can see a similar frothy bloat in feedlots from high concentrate diets. It's not from the plants then, but from specific bacterial slime production happening right there in the rumen.
Okay, so that's frothy. Then we have the second type, free gas bloat. So here, the gas builds up above the liquid in the rumen, kind of like a big bubble, right? But the animal still can't belch it out. The causes here are different. It might be because the rumen isn't moving properly, maybe due to some kind of nerve injury, or even just extended recumbency, cattle lying down too long. That lets the fluid cover the cardia, that exit point.
Exactly. And here's a really critical link we need to make. Esophageal obstruction, what we commonly call choke, well, that directly prevents belching, which leads to incredibly rapid free gas bloat, making choke itself an immediate serious emergency.
Wow. Okay, so it happens fast.
Extremely fast. What makes bloat so, well, insidious is just how rapidly those clinical signs can appear, often within just an hour, or maybe 3 to 4 hours after they've eaten. The most obvious sign, the one you absolutely can't miss, is that noticeable swelling on the left side, the left paralumbar fossa.
That triangle area.
Yeah, that's the one. Right behind the last rib in front of the hip bone. You'll see it bulge out. And the animals will show clear signs of discomfort. They'll be stomping, maybe kicking at their belly, breathing hard. You might also notice them urinating or defecating frequently.
Sounds pretty distressing for the animal.
It is. And in severe cases, the progression is frighteningly quick. The animal might just collapse. That's because of the immense pressure building up on the diaphragm, which then reduces the blood flow back to the heart and tragically can lead to asphyxia, suffocation. It's why, sadly, if cattle aren't watched closely, they're often just found dead.
Okay. Given that urgency you're describing, what does the practical management, the treatment look like? I assume it depends.
Absolutely. The approach hinges entirely on the type of bloat, froth, or free gas and just how severe it is.
Yeah.
But decisive, prompt intervention is, well, it's absolutely non-negotiable.
So for those really life-threatening cases where you're talking minutes mattering, what are the options?
Right, the emergency stuff. One option is trocarization. Basically, you insert a trocar, which is a sharp instrument, or even just a large gauge needle, directly into the rumen. You go in high on the left side, right at the point where it's bulging the most. To release that trapped gas, it can be quite explosive. For the absolute most critical scenarios, you might even need an emergency rumenotomy.
Which is?
A surgical opening of the rumen itself. It provides immediate, complete relief. gets everything out.
Okay. And what about for the frothy bloat? You can't just let gas out easily there, right?
Exactly. For frothy bloat, the treatment is all about breaking down that stubborn foam. So you administer anti-foaming agents, things like non-toxic oils, maybe some detergents or specific surfactants like paloxylene. You can give them orally or uh, often better via a stomach tube. And the sources we looked at suggest paloxylene is generally the fastest, most effective option.
And for free gas bloat, assuming it's not choke-related yet.
Right. For straightforward free gas bloat, the primary immediate fix is usually just passing a stomach tube that lets the trapped gas escape.
Simple enough.
Often, yes. And here's a kind of surprising but sometimes useful trick. For mildly bloated feedlot cattle, they sometimes call them swellers, just walking them around can actually help. It encourages that foam, if there is any, to coalesce into a bigger bubble. Makes it easier for them to belch it out themselves.
Huh. Interesting. Like burping a baby, almost. Are there other general supportive things you can do?
Well, there's a traditional method, kind of old school, tying a stick in the mouth like you'd put a bit in a horse's mouth. The idea is it promotes saliva production, and that increased saliva might actually help break down or denature that stable foam.
Does it work?
Sometimes it helps a bit in milder cases. Another thing is careful drenching, maybe with 100 to 150 grams of baking sodium bicarbonate dissolved in water. That might offer some relief too.
But you said careful drenching. There's a warning here, isn't there?
A huge one. Absolutely crucial. You should never ever drench a severely bloated animal. The risk of them inhaling that fluid straight into their lungs, well, it can cause immediate death or, at best, severe pneumonia. It's just far too dangerous.
Got it. Okay. Prevention seems key then.
Oh, absolutely. From a preventative angle, getting ahead of these issues is really paramount to cutting down how often bloat happens. For grazing management, for instance, it's wise to avoid putting cattle onto very succulent pastures, especially those immature legumes in the pre-bloom stage we talked about.
So timing matters.
Big time. A smart strategy is maybe move cattle to new pastures in the afternoon, after the morning dew has dried off, and make sure they already have a bit of a fill, some fiber from their previous forage, so they don't just gorge themselves. Also, maybe delay grazing those high bloat risk plants for, say, 3 to 5 days after a frost. Freeze damage can change the plant chemistry. And ensuring continuous grazing rather than letting them get hungry and then hitting a lush pasture hard, that helps too.
What about feed adjustments, especially in feedlots?
Good point. For dietary adjustments, if you have mixed grass-legume pastures, maybe fertilizing with nitrogen can help. It stimulates the grass growth, which effectively dilutes the risky legumes. For feedlot cattle on those high concentrate rations, just providing maybe 10–15% of their diet as coarsely chopped roughage, like hay, can significantly cut the bloat risk. And making sure the feed is mixed really well, that minimizes the animals selectively eating just the risky parts.
And supplements. You mentioned paloxylene for treatment.
Right. Supplements play a big role in prevention, too. You can actually feed anti-foaming chemicals like paloxylene before turning cattle onto those bloat-prone pastures. Maybe start 2 to 5 days ahead.
Proactive.
Exactly. Another highly effective strategy is providing supplements that contain an ionophore. Rumensin is a common example. Ionophores basically tweak the rumen bacteria, reducing the pathways that produce so much gas. And finally, check your mineral supplements. Make sure they have enough sodium salt, but avoid excessive potassium, calcium, and magnesium, as those can sometimes influence bloat risk too.
Okay, that's a really thorough look at bloat. Let's shift our focus now to choke, the esophageal obstruction. And as we've already hinted, this is an immediate emergency in ruminants. Why again?
Because it directly stops them from belching, which, as we now know, leads to that incredibly rapid and severe free gas bloat.
Right, the connection. Okay, so what causes choke? What kind of things get stuck?
Well, what's often surprising here is just the sheer variety of things. For solid obstructions, common culprits in cattle are often, well, everyday items. Things like turnips, onions, potatoes, even fruits like peaches, apples, oranges. Their size and shape just make them problematic if swallowed whole.
Things they might find accidentally.
Often, yeah, or sometimes given as treats inappropriately. But feedstuffs themselves can cause impactions too, especially things like improperly soaked or just dry sugar beet pulp, or cubed and pelleted feeds, particularly if the animals eat them way too quickly. And then you get actual foreign bodies, pieces of wood, maybe those antimicrobial molasses farmers give, or even trichobezoars.
Hairball.
Yeah, basically hairballs. And there are other factors that can make choke more likely, like an animal trying to eat while it's sedated, or if there's an underlying issue with the esophagus itself, like paralysis from a neurological problem, maybe early rabies or botulism, or esophageal strictures that's narrowing, often from previous damage or ulcers, or acquired diverticula, little pouches that can trap food. And interestingly, even something like a diaphragmatic hernia can sometimes present with signs that look a lot like choke.
Okay, this is where it gets, well, really critical then, because the signs of choke sound pretty acute and distressing.
Oh, absolutely. They usually are. The hallmark sign, the one that should immediately make you think choke, is that nasal discharge, but with feed material and water mixed in it.
So stuff coming out their nose that shouldn't be?
Precisely. Other really clear indicators are profuse salivation, just drooling excessively. The term is tyolism and persistent coughing. Often retching, like they're trying to gag something up. And crucially, as we now understand, if it's an acute complete blockage, you get that rapid free gas bloat, which can quickly become life-threatening on its own.
So you're dealing with two problems at once.
Often, yes. You'll also see other signs of distress. Dysphagia, they just can't swallow. Obvious anxiety, restlessness. They'll make these forceful, desperate attempts to swallow or regurgitate, maybe stretch their head and neck way out, trying to dislodge whatever's stuck. You might even hear bruxism, teeth grinding.
And you mentioned you might be able to feel it.
Sometimes, yeah. If the object is lodged high up in the cervical esophagus, the neck part, you might actually feel a lump or obstruction when you palpate the neck carefully.
That's useful. Are there danger signs for complications?
Definitely. Be aware that serious complications like subcutaneous emphysema, that's air under the skin, feels crackly, or cervical cellulitis, which is infection in the neck tissues, or fever, those might indicate that the esophagus is actually ruptured, which is a very, very severe, often fatal outcome.
Okay, so given those pretty dramatic signs, how do you actually confirm it's choke?
Well, the diagnosis is primarily based on those obvious clinical signs you just laid out, especially that telltale combination: nasal discharge with feed in it, the heavy salivation, and the rapid onset of bloat.
But definitive proof?
Definitive confirmation often comes when you try to pass an oro or nasogastric tube, and you just can't. It hits a blockage. And as we said, palpating the neck for an object is key, too.
Are there more advanced ways to check?
Yeah, for more tricky cases, endoscopy can be really helpful. You can put a camera down there. It lets you see exactly where the obstruction is, what kind of material it is, and importantly, assess if there's any damage, like ulceration, to the esophagus lining. And it's also vital, really vital, to check the respiratory tract carefully. Listen to the lungs, maybe even get chest x-rays.
Why is that?
Because aspiration pneumonia is a very common complication. They inhale some of that feed material or saliva, so you need to check for that early.
Right. Okay, so you've diagnosed choke. What's the immediate response? How do you treat it?
Treatment focuses first on relieving that obstruction, getting the stuck thing out, and then meticulously managing any complications like that aspiration pneumonia.
So how do you get it out?
Well, first step often involves relieving the obstruction by using sedation and muscle relaxants, things like esopromazine or maybe xylazine, ditomidine. These help relax the esophagus, making it easier to manipulate the object or pass a tube.
Okay, make it less tense.
Exactly. Then sedated lavage is often the next step. This means gently passing an oro or nasogastric tube down to the obstruction and using water lavage, flushing water, to try and dislodge it or break it down. This is actually surprisingly successful. Works in at least 90% of cases, the sources say.
But there's a safety catch.
A critical one. The animal's head must be kept lower than his torso during this procedure to minimize that risk of aspiration of water and debris going into the lungs.
Head down. Got it. What else?
Well, sometimes an experienced person might be able to manually remove a mass if it's right up in the proximal esophagus near the throat just by reaching in carefully. If the obstruction is lower down in the neck, sometimes external massage can work, gently manipulating it from the outside to try and push it back up into the pharynx where the animal can then hopefully cough it out. In some situations, you might even be able to carefully push a large foreign body, like a whole potato, downwards into the rumen where it can be broken down.
Okay, carefully pushing it down. But you mentioned a warning earlier about pushing too hard.
Yes, and it bears repeating. A very strong caution here. Never vigorously ram the object down the esophagus using a probang or any stiff instrument. The risk of tearing or rupturing the esophagus is extremely high, and that can lead to fatal septic mediastinitis, a massive infection in the chest cavity. Just don't do it forcefully.
Okay, so gentle manipulation is key. What about the bloat that often comes with choke?
Right. As we've noted, if choke is accompanied by severe bloat, which it very often is, remember that emergency trocherization we talked about, puncturing the rumen through the left sublumbar fossa is absolutely necessary to relieve that dangerous gas pressure first. You have to deal with the immediate life threat.
Makes sense. And after you hopefully get the obstruction out, what about managing those complications like pneumonia?
Yeah, the medical management of complications is crucial. Aspiration pneumonia is, as I said, very common. It requires antimicrobial therapy, antibiotics, often for a decent length of time, maybe 7 to 14 days, sometimes longer. Drugs like potassium penicillin G, procaine penicillin G, trimethoprim sulfamethosols, or maybe gentamicin sulfate are common choices. You'll also likely use anti-inflammatory drugs like phenylbutazone or flunixin meglumine to reduce inflammation and pain.
Is surgery ever needed for choke itself?
It's rare, but yes, some complex cases might require surgical intervention, maybe an esophagotomy, which is actually cutting into the esophagus to remove the object, or possibly an esophageal myotomy, which is a procedure for certain types of muscular strictures, those narrowings we mentioned. But surgery is usually a last resort due to potential complications.
Okay. And prevention for choke. How do we avoid this happening in the first place?
Well, from a preventative standpoint for choke, the bigger picture really comes down to vigilant feed management and careful monitoring. Practically, this means avoiding feeding potentially problematic spoiled feedstuffs like those whole turnips, potatoes, or apples we mentioned. And crucially, making sure you dispose of any garden waste or windfall fruit in areas that are completely inaccessible to cattle. Don't just throw it over the fence.
Good point. Anything else?
Yeah. It's also really important to closely monitor animals that are recovering from any kind of teeth or tongue problems, because those issues can severely impair their ability to chew properly, which significantly increases their risk of swallowing something whole and causing choke.
Right. So bringing all this knowledge together now, the absolute critical link, the thing to really remember, is that choke is a direct, immediate cause of free gas bloat. It's not always two separate things happening randomly. They're often directly connected. A double emergency.
Exactly. And that is precisely why prompt recognition and that immediate decisive intervention are so profoundly crucial for both conditions. This knowledge, it isn't just theoretical, is it? It's intensely practical. It can literally mean the difference between life and death for an animal. It really highlights the importance of just observing your animals closely, understanding their basic physiology, how their bodies work, and being prepared to act fast when something looks wrong.
Yeah, and it really underscores how incredibly quickly these conditions can escalate, from just looking a bit uncomfortable to a fatal outcome in potentially a very short time, reinforcing that aha moment, maybe, about the urgency, and also highlighting the very specific actionable steps we've managed to unpack today. We've certainly covered a lot in this deep dive. From the surprising way that frothy bloat foam works, almost like cement, to that immediate life-threatening link between choke and free gas bloat, and all the specific ways we can potentially intervene when, every single second counts.
Yeah, and maybe the final thought to leave you with, given the rapid onset and the really serious nature of these conditions in cattle, maybe consider how understanding these subtle signs of distress, not just in cattle, but in any animal, how that can sharpen your own observational skills and potentially lead to you making truly life-saving interventions, maybe even in unexpected situations down the road.
That's a great point. Thank you for joining us on this deep dive today. Keep that curiosity alive, and perhaps even share some of what you've learned.